Hey everyone, welcome back to the newest episode on our Living Life Naturally podcast, where you can learn all things pertaining to women in that midlife phase or even in menopause, bringing actionable tips for you so that you can live a much healthier, happier, longer life. So, of course, I'm your host, Lynn Wadsworth, and I appreciate you joining us today. We have today with us Dr. Kim Peirano. So she actually has some very impressive credentials. She is an experienced transformational coach. She's a hypnotherapist and an acupuncturist, and she blends her expertise in multiple modalities. And in doing that, she supports her clients through profound life transitions. So in her practice, Courage to Transform, Kim specializes in working with clients who are experiencing major life changes. They are living with chronic pain and illness. And she also talks to those recovering from religious, spiritual, and cultic abuse and trauma. So Dr. Kim's coaching sessions are deeply intuitive and personalized, fostering an environment of safety while encouraging clients to break through limiting beliefs and patterns. She integrates the decades of techniques and education to guide clients towards self-discovery, empowerment, and transformation. Now, through hypnosis, Jungian depth psychology, shadow work, five-element theory, somatic integration, and more, she always offers a supportive and customizable approach to her clients. And Dr. Kim is committed to helping individuals reconnect with their true authenticity and offering them the tools and support that they need to navigate life's changes, all with clarity and confidence. So I'm so excited to have you here on our podcast. Welcome.
Thank you.
And where are you joining us from today?
I'm in Oakland, California.
I thought you may be in California,
Mhm.
so a lot earlier for you than it is for me here on Eastern Standard Time.
It is.
So tell me what brought you into this type of work.
Oh, well, kind of just a random happening of events. I did actually my undergrad in art. So I did
Mm,
sculpture and jewelry making, and then I worked at an insurance underwriting place, which was like not
yeah.
my thing. But when I was at that job, I had like extra money for the first time. And so I started going to yoga and I got really into that and
Mm,
was like, oh, maybe I'll go be a yoga teacher. And then through the yoga studio, this guy came and did a presentation one time. He called himself a naturopath, but he was a chiropractor and it was kind of like functional medicine chiropractor before functional medicine was called that. Um, and gave this presentation about how like everything in the body's all connected to the other things. And I was like, yeah, that totally feels really true. I ended up working with him for a little bit on some digestive stuff and then was so fascinated with all of it. I was like, I'm going to go to naturopath school. Uh, well, naturopath school is medical school, and I had an art degree, so it was going to take a lot longer to get into that school. In my search of that, I came across acupuncture schools, which were easier to get into. And so then I had just signed up for acupuncture school without ever knowing anything about it or even having an acupuncture treatment, kind of just jumped in. Um, and then my practice has just kind of shifted and changed over time. So now more primarily coaching and hypnosis that I'm doing. I still have an in-person practice in Oakland.
mm.
Uh, and just kind of as things have changed, like my practice has changed with it. And so now it's like a little more mental health focused, and just kind of helping people deal with grief and loss and things that won't change in our lives because that's unfortunately a part of life.
Yes, it is. And I think especially, I hear some of my older friends making the comment about how they may be experiencing pain or they may be experiencing loss as we get older. I mean, we lose a lot of people around us. So, yeah, you're right. It's never going to change. There's always going to be those factors. But I want to ask you, how many people do you speak with or treat who are in midlife or menopause, and how do you help them? Because a lot of them at that point have got changes going on in their body. They've got pain that they didn't have before, and not fun when you've got pain and you're used to living an active life.
Totally. And so much more than pain too, right? Like that
Mm,
list of symptoms goes on and on and on. I would say probably the majority of the patients and clients I work with are in that transitional phase. Like, so ages like 35 to 60 is kind of the common ages.
yeah.
Whether or not people are coming to work for that specifically, it usually always comes up in some form. And the way I work with that is kind of twofold. Like, so when I see people in person in my acupuncture practice, they might be specifically coming for help with those symptoms. And so we're working with acupuncture, sometimes like herbs and supplements to see if we can get things to change. And then in like my coaching practice, where like I'm working with a lot of people on, especially with hypnosis, like very medical based. So like how we can use hypnosis to help manage symptoms when they arise. And also with the just chronic illness in general, like the emotional, psychological impacts of that. Like, how do you live your life when like you're living with this pain or you're living with these symptoms day to day? Like, how can we still have good connections and like enjoy things while we're still dealing with this other major piece of the puzzle that might not have a good treatment or might not be able to change. And one of the key factors that comes up there a lot is how do we even navigate like the world of alternative wellness?
Mm,
Uh, because there's a lot of like there's a lot of charlatans out here. Like there's a lot of people who don't have any training, and there's a lot of too good to be trues and places where people can spend a lot of time and money and energy and effort and like not get results or like wind up worse off. So some of my coaching in that regard is helping people like find practitioners or what do we look for in practitioners so that we're going into like the treatment plans and the things that we're choosing to do like in a really balanced way, like with our head on our shoulders instead of like just jumping at stuff that may or may not move the needle on what we're trying to do.
mm. I sometimes call that those sparkly objects over there, and Facebook's really good at doing that,
Totally.
jumping up with, "Oh, you need to buy this, it's going to help with this, this, and this." And they are kind of promising you miracles that you know are not going to happen.
Yeah.
So I think that it's very important when you talk to people about what type of doctors to look for. Unfortunately, here in Florida, we don't have naturopaths. They're not allowed to be licensed. And I think it kind of leaves a big hole in how we can get help more naturally. We don't have that many functional medicine doctors either. So the closest we can come in Florida, at least, is finding acupuncturist who really can help. So how does acupuncture help with some of the symptoms that come during menopause, perimenopause?
Yeah. So I think acupuncture is like best used at the beginning. So if you're like, things aren't the same anymore, right? I saw an article once that was like age 35, the last normal period. It was like, that's so accurate. Because like even if we don't have full-blown symptoms yet, like things start changing and
Mm,
shifting, and we're like, this isn't the way it used to be. And that's the best time to like try natural methods and acupuncture herbs and stuff. Because we can kind of help bring a little balance back. So that those things aren't as severe, or that we can kind of stretch that phase out instead of like going into more significant symptoms. So acupuncture, like on a whole, is going to help with inflammation in the body. It's going to help with body pain. It increases dopamine and serotonin. It regulates histamine release. So some people get really bad allergies too with menopause transition. So all of the ways that acupuncture helps with like all of the other things kind of helps with this whole transition. And it helps with so if you're like thinking about getting pregnant in those like age 35 to 45 years, like acupuncture can help improve egg quality as
Mm,
well. That's kind of a longer like treatment protocol to have that impact because it's just a function that takes longer in your body. Um, so we see a lot of impact with like hormone regulation and things like that. For people who are getting like mood swings and like the mental, emotional piece of all of this, uh, with that dopamine, serotonin, like endorphin release, we're having like impact with how mental health responds, right? So if you're getting crazy PMS before your period, like acupuncture is usually a great thing to help kind
mm,
of temper that a little bit. The other aspect of acupuncture practice for most people includes herbalism. So we have a huge Chinese herbal pharmacopoeia. And then very like specific formulas. Like this is like I think the coolest thing about Chinese medicine. It's like you have a
mm,
cold, like we have 50 different diagnoses for a cold. So it's very highly specific to like exactly what's going on for you, like your history, like all of the other symptoms or the way that your body functions can be very specific. So it's not always like a this formula always treats this. Like we
mm,
can make some generalizations, but it's great to work with a person because then you get that very specific. And those herbs will, like, some of them have, you know, kind of endogenous estrogens or progesterone, like can help boost testosterone, or like DHT blockers, which helps block the extra effects of testosterone. So we can get a lot of impact with herbs as well. And then a lot of people now do supplements too, which are
mm,
another avenue. So you
mm.
have like a person you can work with who's guiding you along that path. Um,
So do you mix your own herbs?
I actually don't do a lot of herbalism at all. I
Mm,
have in my little picture here, there's like 7 formulas up here. Um, Yeah, so if people ask me for herbs, I will give them herbs, but in my experience, like I just attract a clientele that's not super interested in herbs.
mm,
And from my experience, like as a patient and like going through school, we get prescribed herbs all the time, and then they sit on the shelf and you don't take them. And like I hate that for people. Like you
mm,
buy something and then it just sits on the shelf and we don't use it. Some people are really into herbs. They have their whole herbal pharmacies. Some of the acupuncture schools are great places to go for that because there's like a lot of, they're learning it all. So there's a ton of options. Um, yeah.
Yes, so one of the things that I know comes up for perimenopausal women is this anxiety that suddenly appears in their life that they haven't had before. And how do you treat that?
So a lot of the time, anxiety, I see it as kind of twofold. Sometimes we have anxiety that's just kind of coming from that like dysregulated nervous system, right? And if we have pain in our body and other things that contribute to that, like it all compounds. So there's some, like I do a lot of somatic work, so like how we can release emotions from the body as well and kind of like get that nervous system regulation. Acupuncture is obviously another great tool
Mm,
for that. I love it when people use it like in conjunction with therapy or coaching, because then you're like getting a very body-based treatment with the practitioner who knows what they're doing around somatics and emotions, can make a big difference. And the other piece of it, like, and it's so interesting, like Chinese medicine has so many great metaphors for everything, how we can describe what's going on. And so in Chinese medicine, like the kind of like age of menopause transition is like we would refer to as like the age of retirement. And
mm,
retirement's like, obviously like retiring from your job or retiring from your job as a mother, right? Because your kids are grown and they're out of the house by this point in time. Retirement's also like retiring old ideas or the masks that we've been wearing or like the persona that we've put on for our whole life to like do whatever, which is like a lot of women have this like shift of like priorities where
mm,
we've gone from like caretaker and taking care of everything to like now what do I get to do? Anxiety. can be a factor in this whole puzzle because anxiety can come like kind of stem from unexpressed anger. So when we have like anger is like we think of anger as like rage and yelling at people, but it's also like drive and passion and follow through and setting boundaries and like sticking up for yourself. Those are like the healthy uses of anger. So anger kind of goes both ways. And when we feel really stifled in our ability to like follow our drive and passions or our ability to stick up for ourselves, and we can't like express that, um, that creates anxiety. And I think of it like a tea kettle on the stove, right? If the tea kettle had no spout and no hole in it, like it would just jump around and be like this shaky, like crazy looking tea kettle, which is to me how anxiety feels. Um, and so we have to release that. So in this part of life where we're really like reevaluating everything we're doing, like who am I now without all of these other obligations, or that um, I've realized like this is what I need or I don't need. How do we learn how to set those boundaries or learn how to stick up for ourselves or like choose the life that we want to? And in some cases, like that's going to be the thing that helps temper that anxiety feeling because we're finally getting an
Mm,
outlet for all this energy that like has to go somewhere in our body and in our mind.
mm, yeah, great points. And what about the pain that comes along? Because it's not just, say, we may start having problems with our period that causes pain we haven't had before, but we also can experience joint pain, headaches, um, different kinds of pain that come along in this phase of life.
Yeah, so that's there's so many things. Um, So obviously, like some things we can track, right? If you're like head hurts all the time, like let's look at your neck and your posture and all of these different things. Like, so sometimes we'll get relief by doing physical therapy or getting acupuncture. Other times, like what we're seeing with like estrogen decline, um, is that like protective effect, which is why like when they kind of rehashed all of the data on HRT, like found that people were way more likely to like not have broken hips and to have less pain when they were on these medications because they're very protective. So we have to be really mindful of like keeping muscle mass on, eating enough protein, eating enough fiber, like all of these things to like keep everything moving. Unfortunately, it's like one of these like always a moving target where there's just like always more to do. Um, and being more mindful about like what's going on in our bodies and just continuing to work with it so that we can come at that like pain piece from a lot of different angles. And there's never going to be like a catch-all like works for everybody method, which is the
Right, right,
unfortunate part of the puzzle, right?
right.
Um, So I think it goes equally into like, what are we doing like very body based? Are we like doing exercise that's geared to build muscle? Are we eating food that's supporting that process? We see like all the time that like dieting doesn't work anymore and weight gain comes back. Um, and I'm a health at every size practitioner, so like I don't do a lot of diet for weight loss in my practice, and I consider it to be kind of harmful. So like when we're trying to like lose weight, like that's also contributing to some of the other problems
Mm,
kind of flourishing because we're not getting the like right nutrient profile. So we shift from like weight loss or being thin to like how can we go to being strong and like have that semblance of control in that way. So by building muscle, we're going to improve joint health by using our bodies in ways that we maybe haven't before. Like all of that's gonna shift things in a probably unfortunately slow manner.
yeah, it's interesting to me because we hear a lot on the TV about uh, people who are experiencing joint pain and then they give them a pill for it and it really helps. But yet, I've also seen some advertisements where I really get behind this, where if you don't move, then your pain is going to be worse. So, I think about my husband who has very bad knees after knee injuries in football and different areas. And he's really good at making sure that he's up every day and in some way he's moving. And it seems counterintuitive because we think, oh, I hurt, I need to rest it. But really, we need to be doing the movements. And as you say, not necessarily the movement that we've done before. And yoga comes to mind, especially for women who are getting into that midlife phase. I think yoga is just such a great practice for us.
Yeah. And like I would temper yoga with strength training, right? Because
Mm,
that's another thing we've kind of ignored, and that's where we're gonna really build muscle. There's a saying that's like motion is lotion, and like
mm,
we do need to move and keep things moving as much as possible. And we see that there was a study, and I remember the graph from it, and it was people who strength trained versus didn't, and how functionality um, changed over time. So like it was everybody was kind of the same for a while, and then like maybe it was like 50s and 60s, people who didn't strength train, like functionality started to go way down, and people who did
mm,
strength train, like it only went down a little bit over time because all of those exercises are functional movements, right? Like a squat and a deadlift. Like we do that every day. You have to go to the bathroom, that's a squat. Like you pick
mm,
something off the floor,
mm.
like that's a deadlift. So they're all very important movements and like muscles to build. And then you temper it with yoga that's going to help with that like muscle tension and the joint lubrication and all of those different things.
Yeah. Um, so another thing I know that personally I experienced when I was going through menopause was you're talking about the neck pain, headaches from neck pain. And I'm assuming that you treat that mostly with acupuncture.
Yeah. Yeah. One of my symptoms is like worsening TMJ,
Mm,
which is also like neck pain, and then your
mm,
arms go numb and all the things. I think we also right now have a very compounding factor of like long COVID that people aren't aware,
yes,
maybe even aware that
yes.
we have, but like my personal theory is like long COVID just makes whatever's going on worse. So like if you already have, if we're in that like perimenopause transition, like it's going to make our hormones go like way more wacky than they already are doing. Um, and so we see like even more symptoms kind of flare up with all of the things compounding together. But acupuncture is great for particularly muscle pain. Um, so if we notice, like, if I'm really relaxed and like I did my stretches, like that pain stops. That's a good sign that acupuncture is going to be a like really good treatment for you. If it's like degenerative changes, like arthritis, or like you have a literal injury in your joint, like acupuncture is going to be helpful, but not like as dramatically
Mm,
helpful as it is for muscle pain. And then another thing that I really enjoy working with and that I find fascinating is like all of the referred pain, right? So it's like
mm,
if you're clenching your jaw, your neck is going to be tight. If your neck is tight, you're going to get a headache that goes all over your head because that muscle's referring that pain to other places. So there's a lot of different angles that we can look at something to help.
mm. Is that a little bit in a way like reflexology, that there are certain areas, certain pressure points that help with? I know with reflexology, they say that certain areas of the feet you can touch and it would maybe be your gallbladder, or if you've got pain when you touch your feet. So I guess what I'm asking is with pain referral, how do you pinpoint what the actual pain is, and how do you learn what the referring pain is?
Yeah, so kind of there's like two facets to this. So on one side, there's a very like literal, scientifically studied aspect, which is like trigger points and motor
Mm,
points. If you hear people talk about dry needling, like dry needling is acupuncture, they just use different words. Um, And that's a lot of trigger point needling, which we do in acupuncture, which also like the vast majority of trigger points also are acupuncture points. So like we've known this for thousands of years. We just didn't have the same words to describe it. Um, and so with the trigger points, there's like maps. You can Google like trigger point, muscle pain or whatever, and it'll come up with a picture of a body and it'll have like the X where the point is, and then the referral pattern of like how that shows up. Um, so that's, like that's an interesting way to figure it out even on your own at home, like where you can go, oh, my head hurts in this very specific location, like trigger point, headache, and it'll show you like which points connect to that. And then with like reflexology and acupuncture, so we have some of that already embedded in it, right? So like this point is connected to this one. But then that system like expands much further out. And a lot of like acupuncture theory, and I don't know much particularly about reflexology, but I assume there's a lot of overlap there. Works on this idea of like mirroring and metaphor. So like we might, there's so many different theories of acupuncture or like practices. So somebody in one type of style of acupuncture might never treat your neck pain directly with the muscles. Instead, they're going to treat your wrist because your wrist is kind of like the neck of your arm. And there is benefit to that, and people do have results. And some of that might be connected to the like fascia that kind of connects all of the muscles together. But the science on like why and how that works is like very minuscule compared to like what we see with trigger points and motor
Mm,
points.
mm. So if you were to give our ladies, say, just one tip that would change the trajectory of where they might be in menopause at the moment, what do you think would be of the most benefit to them?
That's a hard question. Like so many things, right? Um, I guess so, like find a practitioner, find somebody that you can work with that you trust and has integrity. Um, and I like kind of have a list of things that we want to ask that person about. And like, because there's so much stuff out there, right? Like you can
True.
go down the rabbit hole and there's like 80 different formulas and herbs, all these medications, all the different things that you can do. Um, and then there's people that are going to sell you those things that don't know what they're doing also, or like just that too good to be true, right? Like I cured my PMS with this diet, like cool, it worked for you. That's not applicable to everybody. So when we like look for a practitioner, like ask them about their qualifications and experience, like ask them what they would do if whatever you do with them doesn't work. Like, how are they going to refer you to somebody else? When do they know when to stop the treatment? So that like, and that person should be able to answer those questions. It might never come to that, but like those are things that are going to weed out like who we should work with. And like, in no way is it that like just because somebody's only a coach, does that mean that they're not going to be helpful for you, right? Just like somebody could be an MD and not be helpful for you, right? Because we have a spectrum of people, but we want that transparency and that
Mm,
honesty.
mm,
That person like having at least enough education to tell us like, yeah, if we do this protocol for 3 months and nothing changes, like that would be a sign that I would send you to this other doctor I know who like might have more in their wheelhouse than I do,
mm,
instead of like doubling down on it for years on end, that's an unfortunate thing I see happen in some of my clients where they just keep going at it and then they're not getting results and they're spending a lot of time and money and like you end up a year later like the same as you started or worse off when somebody should have been referred out a long time ago.
yeah, that's great information. Where is the best place for people to find you?
So you can find me online and all of the places at Courage to Transform. So couragetotransform.com. I'm on TikTok and Facebook and Instagram. For like coaching, I offer free discovery calls, so you can book that on my website. And Yeah, if you're local to Oakland, California, like East Bay area, send me a message through the Courage to Transform and we can talk more about that too.
Awesome. All of that will be in the show notes. Thank you so much. I think that for a lot of people, even acupuncture itself is kind of a mystery. So I appreciate you giving us so much information today.
Absolutely.
Thanks. Have a great day.
You too.
You have been listening to the Living Life Naturally podcast, where we're on a mission to inform, inspire, and encourage women to live their best life confidently, joyfully, and freely from what's been holding them back. For show notes and free resources, visit holistic-healthandwellness.com. And I'd be delighted if you'd follow us on socials to connect further. If you enjoyed this show, why not share it with your friends? If you found good value, chances are they will too. And of course, a 5-star review on iTunes is always greatly appreciated, as much as I appreciate you listening. So until next time, live life naturally and joyfully.